So let's dive right in because there's a lot to unpack here. First of all, just want to quickly address the response from the public on these MAC models, specifically South Muskoka, that has had appeared to have most pushback here.
Yeah, so I had the opportunity to get to some of the meetings, not all of the meetings, unfortunately, but the ones I couldn't attend personally, I did have my staff attend to make sure that, I had the full perspective of what was going on and that those that wanted to provide a comment, I heard them. Had a lot of people in touch through the office as well. Certainly in South Muskoka, there's clearly a lot of concern and angst around what is proposed. I know that the meeting in both Gravenhurst and Bracebridge, emotions are running high, and that's no surprise when it comes to healthcare. Having been part of healthcare discussions in Muskoka for the last 10 years in one form or another, it does get emotions well tweaked, and we certainly saw that over the last 10 days or so.
So let's talk about the immediate future here of what's happening with this planning process. And, keeping in mind that I know that you're not Doug Ford, you're not Sylvia Jones, you're not in charge of, healthcare and what happens in the province, but again, representing Parry Sound Muskoka, I know at least there are some conversations that can be happening. So from your perspective, how feasible is it for MAC to be able to go back to the drawing board here and try to allow for more public input in these models?
Well, I mean, the public input has been varied, right? I mean, if you look at all the meetings across all the areas, there are different points of view, and so that is certainly creates a challenging situation for MAC. But I think that one of those points of view is certainly extreme dissatisfaction, and I know MAC is feeling that they want to keep the process moving quickly, and that there are a lot of different redevelopment projects within Ontario that are being looked at, and there is a queue, for lack of a better word, and to keep the place in the queue. But as I said at the Bracebridge meeting the other night, I think that the need now is to draw a breath for everybody and take in what's been said at all these meetings. For MAC to take that in and think about what it means in terms of what they've proposed, because nothing has been submitted yet. And the plan is not to submit for some time, and frankly, I would say take longer than the time that has been allotted thus far, or that they feel that they're working on, and I can be that advocate to try and get more time so that the momentum isn't lost. Certainly in my role, to just analyze what's been said, why it's been said, why people are kind of at where they're at with this, and make some, if necessary, make some tweaks, make some adjustments, and ask more questions of the community if you need to, right? So I think there's an opportunity here to do that. And again, my role is to make sure that if somebody needs something, through this process, and in this case, the board, to make sure that if it's time that they can get some more time to work with.
I just want to ask this because you have been through this with the one hospital conversations back when you were mayor of Bracebridge. You were fighting to keep that hospital in Bracebridge. And so it's interesting to me the juxtaposition of this now that you're in this position and seeing your cohort, Mayor Maloney, now fighting to keep the same type of hospital in Bracebridge. What are your thoughts on that? I mean, he did strike quite a position in terms of, he has said himself that he felt this model fell short of what is expected in Bracebridge.
I think mayors and community leaders are going to do what they do, which is look out for the best interests of their community. But I think one of the things we've always been really good at in Muskoka and through East Parry Sound and Algonquin as well, through the hospital discussions over the many years, is working together to try and find points of commonality where we can all succeed, right? And that's what everybody wants out of whatever ultimately the proposal looks like, and that gets submitted for review, is that we all succeed. And so, whether it's the current day mayor of Bracebridge, working with his other municipal colleagues, or whether it's me working with municipalities, or me talking to doctors, or talking to the province, or talking to the board. It's to try and facilitate a scenario where we all win, because that's what we want, right? We want strong communities. We want strong healthcare in our communities. We want to make sure that what we believe is one of those core institutions that serves not only the towns that they're in, but so many surrounding communities in Muskoka and East Parry Sound, that those services are there for us, and work the way that we want and expect them to. And so we can get there. This has certainly been a rough patch. But I think if we just keep working together and keep focused on what we all need to win here, that healthcare will be in good shape in this area for decades to come. But there's some work to go.
Great. And final question, and this is one that comes from the public and not personally for me, but can the people of South Muskoka expect you to champion this project to ensure that they're going to get what they're looking for?
Again, it's my job to create win-win scenarios for everybody, not win-loss scenarios, or scenarios where um, somebody is gaining an advantage over somebody else. So South Muskoka can continue to expect me to work on their behalf, as can North Muskoka, as can East Parry Sound, and frankly the entire riding. It's a big riding. There's lots of people in it, various and diverse opinions. But at the end of the day, I've worked on this healthcare file for a long, long time, and will continue to do so to the benefit of everybody in the riding, and make sure that the representation and their voice is always heard, and that we find ways to go forward instead of finding ways to get bogged down.